Hello. My name is Tara Henderson.
My name's P.J. Wren.
We're here to pitch a smoke-free policy for Lafayette County, Missouri. We're seeking $55,000 to implement this program and to help decrease smoking and secondhand smoke exposure for residents in this county. Lafayette County is located in western Missouri. It's about 35 miles east of Kansas City and is made up of small rural towns. There are a total of 33,278 individuals residing in Lafayette County, and 23% of those residents are smokers. This is 5% higher than the U.S. average, and this rate dramatically continues to increase.
That's right. The 23% that chose to smoke are not the only ones who are affected by their choices. The remaining individuals that do not smoke will also suffer from exposure caused by smoking. In fact, according to the Center for Disease Control and Prevention, secondhand smoke has been found to cause multiple life-threatening conditions in non-smokers such as cardiovascular diseases, strokes, and lung cancer. Going back to the 1964, a total of 2.5 million non-smokers have died from conditions resulting from exposure to secondhand smoke. The only efficient method of preventing exposure to secondhand smoke is to eliminate smoking in public places, as even a brief moment of exposure can be harmful.
Smoke-free laws not only are effective for health benefits, but they've also been found to save millions of dollars nationwide. According to the American Cancer Society, an estimated $53,056,193 would be saved for heart attack and stroke costs, $18,007,702 for lung cancer costs, and a total of $81,609,445 would be saved over a span of 5 years. That's just 5 years for the state of Missouri after the implementation of a smoke-free law.
Those numbers are astounding. And here's the real kicker. There is evidence that has shown that smoke-free policies have been proven to be effective in reducing the use of smoking products amongst current users and also preventing young adults from starting a bad habit. Supporting evidence also indicates that implementing smoke-free policies would reduce hospital admissions for heart and angina attacks, strokes, and asthma-related conditions. They also proved to be significant in improving the health of Medicare beneficiaries with a 21% reduction in hospital admissions for myocardial infarction and an 11% reduction for chronic obstructive pulmonary disease. So in essence, our smoke-free policy does show some promise when it's going to be implemented.
Implementation, you ask? Well, here is our plan of action. As part of the process, we intend to conduct a community readiness survey to assess its preparedness to accept a smoke-free policy if brought up by the council. Based on the results of this survey, we intend to formulate and implement campaigns to educate the community on the necessity and the importance, as PJ just pointed out, of having smoke-free public places. How we'll determine whether or not Lafayette County is ready to back a smoke-free policy will be determined by the outcome of the Community Readiness Survey. If it is determined that the community isn't quite ready, then the plan of action will first be to create campaigns directed towards getting support from the community. Then, in 6 months, we'll distribute and analyze a second community readiness survey. However, if it is determined that the community is ready to back a smoke-free policy, the plan of action will be to go ahead with policy formulation, followed by implementation, and then evaluation.
But like any other programs and campaigns out there is a cost. Our overall projected cost for the proposed smoke-free ordinance in public places in Lafayette County is estimated to be about $53,267 for the duration of 4 months. As part of the process, a community readiness survey will be conducted to assess the residents' preparedness to accept a smoke-free policy. As you can see on the budget proposal, of your $55,000 investment, we will be allocating $1,500 to hire a public health intern who will be made responsible for conducting the survey and analyzing the results. We will be using close to $9,000 for postage to distribute the surveys to every household in the county, and $6,000 will be used towards mass media campaigns. To increase the response rate, we are going to have a raffle where 10 lucky winners will receive a $25 gift card of their choosing. To keep the residents informed, we will have periodic announcements on your radio and newspaper. The education and public program staff will be responsible for formulating and implementing campaigns to provide education for the community on the necessity and importance of having smoke-free public places. The program staff will be recruited by the Lafayette County Prevention Coalition and is paid at a rate of $16 per hour for 30 hours a week for the length of the project. To obtain legal advising and necessary support during the formulation of the policy, the Council will work closely with the local attorney, of which the attorney will be compensated in the amount of $6,500 for services rendered to complete policy formulation. Also, $2,650 will be allocated for meetings and events, and $3,850 is dedicated towards the purchase of equipment such as laptops and other supplies. Travel expenses are factored into our proposal with $4,000 to be used to reimburse project staff at a rate of 46 cents for every miles traveled. The evaluation plan will help determine the level of success of the smoke-free policy. Along with using the community readiness survey, we will be using the employee health assessment data, the county health ranking information, and the Missouri information for community assessment data. In addition to that, we will be assessing the economic impact of the policy and utilizing the suspended particles measuring system to monitor air quality around Lafayette County. With all this in mind, we challenge you to invest in us to provide a healthier Lafayette County.
We know that smoke-free laws saves lives and saves money. Are you ready to become the change that Lafayette County needs? Or are you just going to be part of the negative statistic?
Together, we can make a difference, and an ounce of prevention is worth more than a pound of cure.